Welcome back. The COVID-19 pandemic does not stop kids from having accidents and illnesses that may require a trip to the emergency room. But is it really safe to take your kid to the ER right now? Joining us is Michelle Herndon. She is a nurse in the St. Louis Children's Hospital Trauma and Emergency Department. And before we get started, I have to tell you, I've lived in a few other places in my life, and one of the first things that comes to mind is when you move away from here, from the St. Louis area, you realize how good the hospitals are here and how much you miss that, knowing in the back of your mind that you have world-class hospitals scattered all over the area. And at the very top of that list, and as a parent, it's very important to know the St. Louis Children's Hospital, one of the best in the world, is right here in our neighborhood.
Absolutely. As a nurse at the hospital, I know this, but I also know it as a parent. I've had children in the hospital for, some admissions, and I meet other families and they tell me they're from, hours away. And I just think to myself, I had to drive 10 minutes to get here. And I really do realize how lucky we are.
We really, really are. All right. So we're in the middle of this pandemic. In people's minds, people that get sick go to places like emergency rooms and hospitals. So we assume that you're plump with sick people that are running COVID right now. And the question on our minds, obviously, is it safe to take our child to the emergency room during this COVID pandemic?
That's a great question. And as a nurse, I get a lot of texts, a lot of calls from my friends, and especially because they know I'm a pediatric nurse. So these calls are typically about their kids and their child fell or their child's having problems breathing, but I'm afraid to take them to the ER. Is it okay? So I absolutely understand the question. And my answer is 100% it is safe. We have a lot of safety precautions in place that are directed by our infection prevention team. And we are following a lot of different protocols because of the pandemic.
Well, I'll ask you to expand on that a little bit if you could, because I think people talk about, we wipe this off with wipes and we make sure we do this or whatever else. But what other type of safety measures are in place at the hospital?
Yes. So what's important for parents, caregivers to know before they bring their child to the ER is it is going to look different than if you've ever been there before. First off, there's going to be a screening right at the front, right when you get to the ER. We're going to ask questions about symptoms, about possible exposure to COVID. And then everyone will be given a mask. If you don't have one already, we are requiring everyone to wear a mask. The waiting room looks a little different. We've sectioned off areas so that social distancing can be followed. While we really want to try and get patients back to their own room as soon as possible, sometimes that can't always happen immediately. So having those areas marked off helps to maintain the social distancing. Another thing that's going to look different is that everyone's wearing a mask. Sure. Everyone's wearing eye covering. Everyone's wearing, kind of some things that might even be scary to kids, right? So parents really can prepare their kiddos that, they might even have this big space helmet looking on. And that's just because all of the staff are taking precautions with all of their patients. And it's not that your specific nurse is wearing something special for you. Right. It's that we are all taking those universal steps.
That's a good idea, to talk to the kids before they get there so they're not overwhelmed with this, hazmat situation. Nobody knows better than the hospital, and they don't want to be overwhelmed at the hospital, so they're going to take every precaution that they know of, and they know of a lot. Michelle, thank you so much. We're going to post this segment following the show at KMOV.com/greatday.